Good afternoon. Imagine being diagnosed with a condition that you'll live with for the rest of your life, one that can affect your vision, your organs, and even your life expectancy. Now imagine that the medication to manage that condition you have exists, but you can't afford it. For millions of people living with diabetes, that's not just a worst case scenario, it's a reality. According to the American Diabetes Association, diabetes is defined as a condition where the body's blood glucose levels are higher than normal, resulting from the body's inability to store blood glucose for energy. There's a lot of different nuances when it comes to diabetes. There's actually 6 different variations of it, but typically the ones you're going to hear about is type 1 and type 2. And type 1, as defined by the American Diabetes Association, type 1 is defined as the pancreas can no longer make insulin and blood glucose, cannot enter the cells of the body to be used as energy. And then type 2 is either the pancreas does not make enough insulin or cannot use the insulin it does produce effectively, which they both kind of have the same result, which is that your body cannot use essentially like the blood sugar in your body, and it can't use it as energy. Today we will discuss the problem that is healthcare for diabetics, or a lack thereof. This is a social justice issue that affects millions of Americans and hundreds of millions of people with diabetes globally. Hello, my name is Matthew Rodriguez, and the purpose of my speech is to persuade you to support a better system to provide healthcare to diabetics. As a student pursuing human biology, I've spent time studying healthcare and chronic illnesses like diabetes. On a more personal level, 2 of my closest friends since childhood have type 1 diabetes, like they were born with the condition. Growing up with 2 friends that have diabetes, I got to kind of on a personal level see them inject insulin, monitor their insulin levels in their body. And as a kid who doesn't know anything about that, it was kind of dang, it's kind of a crazy kind of experience to see, especially having a child's lens looking at the issue, because it's kind of it's definitely a thing that they have to think about 24/7. They can't just eat whatever they want. They can't eat a lot of sugary things necessarily. They always have to be monitoring and looking at their diabetes, or if they didn't, in some cases, just because the way being in school with them, the way the school schedule is and the way lunch kind of is, it's there would definitely be a noticeable, they would get fatigued, or they would start getting shaky, and it's they have to eat something, or they have to insert insulin. So I've witnessed firsthand the challenges that people with diabetes have faced with managing their condition, but also navigating the healthcare system that we have in place. Those experiences have definitely deepened my interest in the healthcare system and its role in supporting those with diabetes. Now that I've given you a preview of what we will be discussing, let's begin by looking at what the problem is and defining what the problem is. One part of the problem is millions of people around the world live with diabetes, yet a significant number lack access to the essential health services needed to manage their condition. This includes affordable insulin, testing supplies, education, and regular checkups. According to the International Diabetes Federation, over 50% of adults with diabetes globally, in the world, are not receiving adequate treatment. To talk further about, according to the International Diabetes Federation, 252 million people are estimated to be living with undiagnosed diabetes. 589 million adults adults being ages 18 to 70 are living with diabetes. And it's projected by 2050, so we're in 2025, so 25 years from now, it's projected that 853 million people will be living with diabetes. So in just 25 years, almost the number of people with diabetes globally is almost doubling. It's about 100, 200 million shy of doubling, and yet it's still like an ongoing problem that a lot of people do not have access to healthcare and do not have access to treat this condition. This is a major social justice issue because proper diabetes care shouldn't be a privilege. It shouldn't be like a cost thing. It's a medical necessity, and it should be essentially a right, because it's like a person's right to live. And without the proper treatment, diabetes can lead to great hindrance in like someone's life condition and their life expectancy. It can lead to blindness, it can lead to kidney failure, it can even lead to amputations, and then obviously death. This issue is especially urgent in low income and undeserved communities where people are more likely to face barriers to consistent, affordable care for their diabetes. Also, as I said before, according to the International Diabetes Federation, 537 million adults living with diabetes worldwide, and many more undiagnosed. The lack of access to care is not only widespread, but it's growing. And even in wealthier countries like the United States, people ration insulin or they skip treatments due to cost. This issue is both a global crisis and it's deeply personal, affecting people with families or friends that have this condition and that suffer from it every day. My proposed solution to this global crisis would be to expand affordable and accessible diabetes healthcare through increased funding of public health services, better insurance coverage, and policies that regulate insulin pricing from like a government perspective, like capping the price of what this medication costs, and also just promoting like health systems that treat diabetes care as an urgent priority, not just like a luxury, since it can be a very debilitating condition. So this approach is supported by global health organizations like the World Health, the World Health Organization, and proven public health models. For instance, countries with universal healthcare like Canada and the United Kingdom have far better diabetes outcomes because of consistent access to medication and care, which essentially translates to less people going blind, less people suffering from organ failure, less people dying from their diabetes condition not being managed from like a healthcare perspective. While fully implementing like everything I just suggested, it may take time and it's going to definitely face political and financial challenges. The solution, like realistically, it's evidence-based. Everything I propose, there's already been pilot programs that reduce insulin costs or expand access to care, and they've already shown success. They've already shown better outcomes for diabetics. So we don't need to like reinvent like our entire healthcare systems. All these countries don't need to reinvent what they already have. It just needs to be, the programs they already have in place need to be expanded. And then also for countries that don't have the resources or can't allocate the resources to a better, more like modern healthcare system. So the benefits is better access to diabetes care will save lives, reduce suffering. Fewer people will face preventable complications like amputation, organ failure, early death. Secondly, this solution reduces long-term healthcare costs, preventing diabetic complications. It's far cheaper to have preventive care than to be caring for someone who's already had amputations done, has already had to go through like organ failures. Finally, addressing the issue shows a commitment to health equality and justice. It says that everyone, regardless of your race, regardless of your income, regardless of your where you are geographically on a map, you deserve the tools to live a healthy life. In conclusion, I'll leave you with these final words. Diabetes doesn't have to be a death sentence, which it is for many people who don't have the proper care. If we work together, make sure everyone has access to the care they need, you can make a difference by supporting efforts to make insulin more affordable and by raising awareness for this social issue. Even small actions can help move us toward a more caring and fair healthcare system. Thank you.